Hi everyone. I'm Pallavi. I'm a podcast host and also a content creator. And today I'm privileged to have Dr. Kushal Pandya and Dr. Ashray V with me, who are the consultant emergency medicine at Aster Whitefield. Thank you so much, doctor, for joining me today.
Thank you for having me here.
Thank you, Pallavi, for having me on this podcast.
To start with a very lighter note and to have an ice-breaking conversation, if life would have a real crisis button, I think the emergency controls would be with our emergency medical doctors. So, what is the golden hour in between which you think a patient should be able to reach the emergency, say for a stroke or a heart related disease?
Golden hour is the period where you have to treat the patient in that particular time. And why that is named as golden hour? Because if you treat in that particular time, the outcome improves. Yeah. So the golden hour for a stroke is different. Golden hour of heart attack is different. So golden hour for a stroke is roughly around 4.5 hours, and for a heart attack is roughly 90 minutes. So once you start treating that, the outcome really improves, and that is what is the golden hour. Now the problem is the traffic in Bangalore is unpredictable. You never know when you're going to reach the hospital. So few things which I keep for my family ready is the emergency numbers. The nearest hospital which has everything available in one roof, like a heart, cardiology, neurology, neurosurgery, everything under one roof, multi-speciality kind of. Yeah. Yes. Second thing is, let's say you are stuck with in a traffic with a patient who is having either a heart attack or a stroke. You keep speaking to the patient. Okay, keep him indulged, even though if he is not speaking, he or she is not speaking. You make sure that you have some feedback from their side, either eye movements or hand movements or something, so that what happens is you come to know that patient, how the patient is doing. Patient is deteriorating, patient is improving, or it's same. Okay, you don't tell the patient to sleep and I'll wake you up when the hospital comes. You don't do that. Yes, keep them engaged so that you come to know the condition of the patient.
So my question for you would be, doctor, that how do you instantly differentiate between a patient who has come in an ER, whether it's a panic attack or a real cardiac arrest?
I think this question is there in a lot of people's minds of late, because there's a lot of awareness about cardiac arrest. And it's very important that we follow certain basic steps while assessing a patient who has become unresponsive. So what is typically called as the BLS assessment. So that involves basically checking for responsiveness. So what we usually do is we tap on the shoulder of the person if in case they've collapsed or they've become unresponsive. And we have to call into their ears and ask them, sir or madam, are you okay? Slightly in a raised voice, because if there is a person who is hearing impaired, then they should be able to hear when we speak in a loud voice. And then the next thing is to check if they're breathing normally or and if they have a pulse or not. So we at the same time check for the pulse, which is known as the carotid pulse, which is the strongest pulse in the body, which is usually situated right on either side of the Adam's apple or the voice box. Right, there's a small groove over here between the muscle and the windpipe. So we usually check the pulse there, and we check it for at least 10 seconds. Now, if there is a pulse that we are able to feel, then we are at least sure that the patient is not in cardiac arrest. It could be some other emergency like a fainting episode or what we call a syncope. Now, if the person is in cardiac arrest when they don't have pulse and breathing, then if they're trained enough and confident enough, they can administer cardiopulmonary resuscitation or CPR.
So how do you learn the CPR? There is something called as basic life support, BLS, which we conduct in our hospital regularly. It is recommended for everyone, including the common people, to learn that course so that everybody should know what to be done in an emergency.
Right. And also in society buildings, you have some equipments, emergency equipments to revive, right? What are they called and who are trained? I don't think so everybody is trained in such situations.
So yes, in Aster, what we have done is the nearby colonies and all that, we have recognized few people as volunteers. And we have trained them. We are still training them. The program is still underway. And we are training them what to be done in an emergency. So those devices, what we do is we have given them 2 kits. The list of the kits is called as a first aid and an AED.
Right. I'm assuming schools and corporate offices also.
Yes,
right?
yes. We have done for them as well.
So now we spoke about, say, heart-related conditions or stroke. What about accidents? What should common people be aware of in such situations before they're bringing, the patient to hospital? how should they handle the patient? And
So it depends on the severity of the accident. Let's say if it is simple trivial fall which has probably a leg injury, and we suspect that okay, the leg has a fracture or something, we only immobilize the leg either with a stick nearby, or with some plaster if you couldn't get nearby. In the, let's say in the first aid kit we have put some plasters there, so that you can just stabilize the leg until the advanced help arises. But if it is a very severe trauma, including the head injury, the spine injury and all that, we recommend to keep the patient on a spine board, it is called, which is commonly available in the corporates at least. Okay, so we make them lie on the spine board so that the patient doesn't move, and call for the nearest ambulance.
epilepsy and fits for few people having it regularly, should they inform at their workplace about that condition beforehand? Because it is something which I think they can address by themselves. They don't need to come to the doctor unless they are not getting fined for a prolonged time.
I think it's essential that they inform their workplaces, because in the case of an emergency, the workplace is prepared to act accordingly and get them to the nearest medical facility in case of an emergency if they develop a seizure at their workplace, which is we have seen quite a few patients like that. And because I think their workplace is notified, so they're able to act faster and then get them to the nearest healthcare facility, and first aid can be administered, all the necessary treatment can be done.
And as emergency, again, like, it's the time is so essential and crucial over here. So if more than one emergency cases have arisen, so we know there is something known as triage, by which you will prioritize which patient to cater to before. Can you elaborate on that?
Yeah, so it's a very valid and important point, and the audience must know it. Triage is something is divided into three main categories. One is a red, one is yellow, and one is green. So what does it, when a patient comes to us, we divide the patient into three categories. Very sick patients whose BP is low, who has an accident with a head injury, whose either BP is very high, or he has some cardiac symptoms like chest pain, sweating and all that. This is category 1. So we don't wait, the patient doesn't have to wait for any doctors to come, they wheel in directly to the emergency. That is a red zone. The yellow is a moderate category where there is some kind of dehydration, there is some kind of injury to the organs, but they are not that sick patients. That we usually the time to see is usually 10 minutes. And green zone is simple fever, cough, cold, simple injuries, simple cuts. Then that can be seen within 20 to 30 minutes. That is what triage is all about. So let's say a 3 patient comes together, and one is red, one is yellow, one is green. We always prioritize red zone first. We stabilize it, because if we don't treat, that patient might lose their life.
So, Dr. Bangalore, like urban city, pollution is increasing so much. What are the new respiratory cases that are coming for ER?
These whatever respiratory emergencies we get are usually in the winter season, when pollution also is slightly more difficult to deal with. A person who's staying in a city which is quite polluted, over a long duration, over many years, they may develop certain lung diseases that can happen
Due to exposure.
Exactly, due to exposure of pollutants and the particulate matter that is there. The other thing is, pollution also will contribute to increasing the number of infective pathologies, that is basically pneumonias and flus. All of that can increase because of the cold weather and the pollution.
Basically, to focus more on the urban city lifestyle, sedentary lifestyle, or a hustle culture, do you see more of the crash cases coming in the emergencies?
Yes. So we know that Bangalore has a startup ecosystem which is amazing. Brilliant mind at works, and they do come with certain complications, right? They have a lot of stress, they have a lot of caffeine. So the
Energy
stress
drinks
and
also
caffeine,
probably.
so the stress, caffeine, nicotine and energy drinks don't go well together. Okay, so we have seen quite a few crashes known when a person collapses with no pulse, the heart completely stops. That is called as crash. So when we have seen quite a few crash patient recently, especially between age group of 20 to 40, which we were not seeing before.
So, doctor, now we hear a lot about young professionals, fitness enthusiasts who are collapsing while working out. What are those cases? If you can just let me know if they are coming more often to the ER.
In fitness, when we start working out or going to the gym, it's very important to take a staged manner in which we increase our level of exercise as well as the intensity of the exercise or workout. So what happens is sometimes when at the instant when they start working out itself, if they tend to go towards heavy exercises, probably say like lifting heavy weights or doing excessive cardio or running everything, what happens is the body is unable to take that extra load of energy.
And does those supplements, energy drinks, all those things
Exactly.
combined clustering effect also does it
Yes,
make?
yes. One ends up taking too much of excess of the supplement or the energy drink, and they don't work out adequately. Then it can cause problems. So some of these supplements are known to cause, if they're if they're taken in excess and not worked out, then excessive dehydration can contribute to little bit of kidney damage as well. Because of dehydration itself, they can have again fainting episodes or syncopes. So these are a few common things that can be expected, and especially those who are starting above the age of 40 or 50, say at least around 50 years of age, considering their age, it would be advisable to get a basic health check or a basic health evaluation done before they start doing intensive workouts.
Right. So, like you mentioned, 20 to 40 years old is a rising trend. What is the youngest that you have treated?
18 years with
And I'm
a
not
heart
talking
attack.
about, of course, accidents. I'm talking
Not
about
accidents.
health issues.
The health issue as in a heart attack. We have seen the youngest being 18 years old.
So we spoke about, caffeine, about drugs. What about sleep? Sleep deprivation is also something which is neglected.
Sleep deprivation, apart from sleep deprivation, of course, the screen time, along with the sleep deprivation, both has caused such kind of stress in the community. So the doctor always advised you to switch off the mobile, no screen time before sleep, so that you can have a sound sleep.
Yeah.
6 to 7 hours of sound sleep is mandatory for everyone, because it not only affects your brain, it affects entire body, including your heart.
So when we talk about sleep hygiene, doctor, so like you mentioned that there should not be screen time right before sleeping, even caffeine intake. What are the other necessary sleep hygiene parameters that people should take in mind?
So a few parameters are not eating before 3 hours before the sleep.
Okay.
Mandatory a small walk after the
last meal. Okay.
No screen time. Off the work, no work before at least 1.5 hour before the sleep. Spend some quality time with your family, with your kids.
Nowadays, people are using the health trackers, maybe wristwatches, to monitor their sleep quality. So, do you think that it is something to be trustable? Are those devices actually generating real results?
I don't know particularly about the sleep study per se. But again, yes, few of the gadgets, even I use it. I have quite good outcomes based on that. So I can come to know that whether my sleep was adequate, not adequate.
And deep sleep.
Deep sleep. But again, the studies have shown that these gadgets are adequate, but it depends on company to company. So very difficult to tell which company is good.
Doctor, in your experience at Aster Whitefield, in the emergency cases at night specifically, what are the cases that arise most?
Okay, a lot of the emergencies come up during the night, and it's a wide spectrum of emergencies. They can range to something as simple as a gastritis or gastroenteritis with dehydration, to as complex as a heart attack or a stroke as well.
So doctor, the long hours of corporate employees sitting and working, do you see an increased trend of people coming to ER because of DVTs?
Yeah, so we have seen a few patients with a DVT in the last few years. DVT means deep vein thrombosis. So what happens is when you sit for long hours with uninterrupted sitting, blood pulls inside in the legs, and that pulling will cause formation of clot in your veins. This is called as venous thrombosis. The problem with this venous thrombosis is it can dislodge, and that dislodged clot can go into your lungs, which is called as pulmonary thromboembolism. So this pulmonary thromboembolism is very risky, is very life-threatening, and we have seen quite a few patients who have arrested because of that.
So is there a way in which they can early detect it? whether they are prone to it or they have it in some other place. Like you said, from legs, it can move up to lungs.
Correct. So, what the studies have shown that roughly, if you have an uninterrupted sitting for more than 8 to 10 hours in a day, the chances of DVT increases in you. So, what we recommend is usually, take a break every 1 to 2 hours for 10 to 15 minutes. Stretch yourself, have a walk inside your office, do some ankle raise stretching exercises that will prevent this kind of DVT. And also the most important part to prevent is hydration, adequate hydration. Drink a lot of water.
Now, doctor, about the heat emergency cases, do you face something similar in Bengaluru?
We have seen, actually, Bangalore was not the place for heat emergency, but last few years we have seen a lot of heat emergencies, especially where I practice in Whitefield. So we have seen a lot of heat related rashes, dehydration, exhaustions in the last few years, which has increased. We recommend to understand the symptoms first, because let's say you are at a site and a patient is at site, he will start having headache, giddiness, weakness, tiredness. These are all the early symptoms of heat related illnesses.
So, doctor, I want to know about the ecosystem of emergency, say specifically to Aster Whitefield.
Right.
Like, for example, you must be operating 24/7.
Yes,
How does
yes.
it operate? And also, you must be having specialized doctors in case somebody needs a cardiac
Yes, yes.
surgeon or somebody needs some accident, suppose. So, they
Yes,
need an
yes.
orthopedic surgeon for that sake. How does this ecosystem work?
Once a patient arrives at our hospital, that's in Aster Whitefield, like you mentioned, our emergency runs 24/7, quite like all the emergencies across the country.
So, the diagnosis center and all of that stuff is open 24/7?
Yes, that is open 24/7,
wow.
and even the cardiologists are available at any point of time. So if we identify a patient has come in with heart attack, and they require an angioplasty or an angiogram, so the cardiologists, we discuss with them the patient's findings and their necessary details, and then if they require an angiogram, angioplasty, they do come in at any time of the day.
Apart from heat, also pollen allergy is something in Bengaluru which is much discussed about. Do you have emergency cases around that?
Every day we have pollen allergies. At least one patient do come to us with a pollen allergy.
What about the self-medication? Especially in these cases of allergy, I think many patients, they just feel like they'll go to the pharmacy and over the counter, they'll just take a medication.
Correct.
What do you have to tell about that?
We do have seen patients worsening because of the self-medications.
Right.
So they take an anti-allergy and they wait for 1 or 2 days, and the breathing difficulty worsens and they do come to us with a very severe state.
In your experience over the years, have you seen some case which was maybe primarily it was not such a big issue, but due to home medication, it has become into something much
Yes,
bigger?
we have seen a lot of such cases. In fact, last week we had a case where there was a small carbuncle in the leg of a diabetic patient. They thought that it is just a small pus-filled carbuncle, nothing to be done, and they popped it. And that infection grew to the whole leg. And patient has come to us with sepsis, with septic shock, and patient apparently had to go to ICU and undergo a surgery.
Do you want government to be more proactive in ensuring the ambulance and the traffic rules can be managed better?
So I think yes, definitely, considering ours is one of the cities that's notorious for its traffic. There have to be some initiatives from the government side where they can regulate traffic better, especially to give way for the ambulance.
Thank you so much, doctor, for your valuable time. It was so helpful. Before we wrap up, do you want to share something to the audience?
Emergency can strike at any time, any age, or anywhere. So it's very important that I think one should be acquainted with common emergencies and how to deal with at least the first aid part of it.
Just don't want to see young people dying. That's it. So in case of any emergency, act fast, understand the symptoms, remember the time, go to the nearest hospital, wherever it is available, and stay hydrated, stay healthy.
Thank you so much for being with us in this amazing conversation where we got to know so many new things and we were refreshed about the things which we should ideally know. And thank you so much, doctor, for giving us this time.
Thank you. So thank you, Pallavi, for inviting me here.
Thank you so much.